end, I would just say one thing is that this is the genome that we are talking about. If there is little bit change in here, particularly in N gene and also in the ORF gene, then it becomes either MERS or SARS or the Ebola. But this is a three kind of the gene that we detect in the wastewater: ORF, S, and N, which means that they are broken genes. And even if they are not broken, we break them, because RNA extraction is the procedure where we lyse the cell. We break the cell and then try to withdraw the RNA, and then analyze that how much ORF gene is there, how much S gene is there, and how much N gene is there. So if all three genes are there, then we say that, okay, this sample got the coronavirus in it. And why we call it corona, Professor Bhattacharya has already told, but still I would say because of the crown-like structure. And it has a crown, so we say corona. Very easy. So then this is the one point. Of course, I would again skip because there are a lot of understanding has come on that. This is also the same kind of the one that Professor Bhattacharya has shown about the water cycle and virus pathway. This is one of the interesting studies that if you don't, I have shown you that the 6th member of this genetic virus SARS family was known, and coronavirus known. But if you don't believe me, I have just one evidence or proof is that this paper was published in 2013 and submitted in 2012, December 2012. Maybe after 7 years, there is some kind of conspiracy or something. But what they have done is that they took the 10 sample from 5 wastewater treatment plant, where there is 100,000 of the people and 100,000 of the people where the waste of them were coming. And then they analyzed all the DNA, some of the DNA virus like UPS virus and parovirus and then RNA-virus. Now, if we go to this table, we can see that the coronavirus was on the top. And the detection of the coronavirus was 83%. So 83% of the sludge sample taken from the wastewater treatment from USA had coronavirus. And that is why recently you might be hearing about Italy got this in December, while the first patient was announced something in February or March. Another study has come that Barcelona has got this corona in March 2019. And in Wuhan, we have got it in December. So whether the Barcelona is the origin? Actually not. It is the impact of globalization and that people travel for sightseeing or for business and so on and so forth. And wastewater epidemiology, Professor Bhattacharya has done, covered it most. I would just take you just this diagram. I hope I would be able to convey that this is the one thing is that they have taken the several week the sample from the wastewater, and they contacted hospital, and they asked that how many patient has come for the gastric or diarrhea kind of the problem, which is related to the virus. And hospital gave them these black dots. And wastewater gave them these red lines. And I mean the red dots. And then they connected it. What we can see clearly is that in the hospital, number of patients increased much later than at least 2 weeks later than what was the peak observed in the wastewater. So what we got actually, or what is the advantage of doing wastewater surveillance is advantage of 2 weeks. And that is where it becomes very useful and like that. So this is a kind of the part 1 about the introduction of the viruses, and those things have finished. If you want me to stop and then say about the Indian case, I can do it later. So what is plan, Bhattacharya sir? Hello?
Okay, thank you, Manish, for this part. So now you can start with your next part, or yes.
Okay. So then so now I would this part will be a little bit. So thank you that you have taken a right decision to go ahead. So then I have already told you wastewater surveillance, and many people say that why wastewater surveillance? Because some people doesn't do it, and that's why they don't like it, or I don't know what. But the problem is that they don't understand that clinical test can give you one by one person. Even somebody can come and take a sample from me, my children and wife, or even if there is a 5-member family and only one member is tested, it is not the something about, you cannot tell that all the people in the family is fine. But if somebody take from in the wastewater of my colony, where there is all wastewater is being collected and no genes are found, we all can know that, okay, none of us is infected till date. So that is the use. And this is a costly. And in a country like India, it is almost really impractical, where government have told that one symptom, for a symptomatic patient, you don't need to test it again once your symptom gone. It means that is recovered. You don't need to perform a test again. And this paper, Professor Bhattacharya has shown, but because I told you that this Barcelona and Italy thing was the result of globalization, I also wanted to bring it for the same reason, that when this time COVID happened, we were prepared with the internet, we were prepared with the connectivity, we were prepared to make this consortium. And then as a result of this, that within 3 months, now the many South Asian countries are coming up that, okay, we could do it. And it's not like, okay, and now even somebody who was leading or whatever, but we are at the same problem. And I mean, everybody is working at the next problem rather than just the previous problems and something like that. So if you want to read about this, or if you want to register your institute, you can use this web page, and you can register that, okay, we also want to come along. No problem. It is, of course, at that time it was 51 institute, but the number has gone way ahead. I would skip this one. Just one thing I would say is that as far as my, there are several the COVID expert who has, because when the time demands, people has to stand up. But in my case, it was little bit preparatory was there, because I have been working on the virus since 2016 or 2017, I would say, from January. And because we taken the sample in 2017 February and the June, and then again 2018, and in Guwahati. And norovirus is a kind of similar virus, because it is also an enveloped virus, like our SARS CoV-2. And we have found that we reported this in Science of Total Environment. And what we have, these are the red one is the norovirus. And we can see that the red one is the pre-monsoon. It means a winter in the Assam or Guwahati, a kind of, and in the post-monsoon, in like July, there was no norovirus detected, almost. So it means that temperature do have some role, of course, but the human-to-human infectivity still goes on, and something like that. Okay, so we did sampling, and we have this kind. Okay, this is many times I would say that the Professor Bhattacharya has just pushed me, and then these news people pushed me, and then of course we came up with this. And what happened is that at that time there was no supply. And sometimes I would say, I have seen that many young students are hearing this webinar. I would say that that adversity is challenges bring the opportunity also. And today, this polyethylene glycol method plus sodium chloride method is the most popular method to detect SARS gene in the wastewater. And before our study, it was mainly and mostly was the filtration thing. We published 18th June our archive the paper on the archive. And before that, if you will see that many developed countries, like Professor Bhattacharya told that a filtration unit, and Japan has the filtration unit, many sophisticated and all that stuff. But filtration means we have to filter it or concentrate the sample, because gene in the wastewater is very diluted. So we have to concentrate it. We cannot, and if I would say, please reduce 1,000 liter into 1 liter, most of you would put it on the fire and evaporate it. When it becomes left one liter, you say, okay, I have done it. But here we cannot evaporate, because otherwise genes will be denatured. So either we have to go for a filtration thing, or I have to precipitate the virus, whatever is there. And so that is how we have done with the PEZ and NSA. And but we have also done the filtration thing. And that's why so I will show you that's why we have the result of the two technique. Then this is the very early the type where the Australia, Netherlands, USA, France, they have told. And so infectivity in our sample, India has the 100% detection, and in the treated water there is the 0%. The one I would this is also the being reported again. I think the audience is bit not so. I mean, if you want, I can explain, but I would keep it for later part if somebody wants to be. But these are the color of the genes, and all the 3 genes were found in that is why this red one is the control, and other 3 are the genes. So that is what we have done. And this is the 8th May we have done, and then 27th May we done, and we have correlated with the population, and we have found that 27th May our gene was 2 times higher, and number of patient the gene was almost 10 times higher, but the number of patient in the city was 2 times higher. So this was the summary that we have found in the outlet. Again, I would like to skip this because I have much more interesting things. So this is our paper, and which is published in here, and the same paper is now I am revising. You can see that this is came as a revise. And then so some of the findings that I want to tell is that first ever report, as Professor Bhattacharya kindly mentioned. And then the CT value is explicitly indicative. All 3 genes were found. None of the genes were found in the effluent, and there was a temporal difference can be there. And it was taken up very nicely through around the world, and several, I think more than 50 news medium or those things has occurred. Still, we are doing some interviews and all that stuff. And of course, it has started with just with one email of Professor Bhattacharya. So then that is the one point. Okay. So this is again the graphical abstract to tell, but again I lack of the time. And so now, like I told you, that we have the challenges, or adversity brings the, how to say, the opportunity also. So this is now we have submitted to Journal of Hazardous Material, and you can see 8th May and 27th May. We found that 8th May in the, and this was the, what we did is that we took sample from every point, and that luckily that treatment plant has UASB, and nowhere in the world anybody has reported what is the effect of an anaerobic up this sludge blanket reactor. So in that case, so then, but we are now reporting it. And not only we report that what is happening in the 8th May or the 27th May, but we are also reporting the 2 method. So here we are also, the paper title says decay of this treatment plant with the 2. So here the highlights are that we have now almost, I don't know that what will be the fate of this work, but of course the polyethylene ethylene glycol we have told that has the better inhibition removal than the filtration methods. And these things we have. This one I am sorry for because it might not be very visible. But you can say that here you can see that the treatment, after treatment, there is many people start saying that the coronavirus is easily getting removed in the water and all that stuff. But this paper of mine is going to break some of the things, because you can check that the China studies from Zhang et al. 2020, they say before treatment they could not detect any virus, and gene, and after treatment they had in the order of 10 to the power 4. It's 10,000 copies per liter of the genes was found. So it is not so simple at all. So in that case, that is what we argued in this paper, and let's see what happens. And but having said that, I would say that rain is coming, and so the urban flood, and you are in the good part of the country where there will be more rain, and you will enjoy more cha or the pakode. But the point is that so far it is not, infectivity is not reported. And last but not the least is that the wastewater surveillance is much better than the clinical one, because clinical one is जितना दिखता है उससे ज्यादा छुपा हुआ kind of thing is there. And so that is, if you do 10,000 tests, see number of people, there is a news, today there is 200 new patient was found. They never mentioned how many tests you did. So if I did, let's suppose that 200, I have done 10,000 tests and I got 200 people. So if I will do 1 lakh tests, then I will have 2,000 people. So, but in wastewater, you can think about community thing. Now there is a lockdown, but nobody knows that weather condition is improving or decreasing. That question also can be answered through the wastewater surveillance. And of course, there are little bit, but I don't want to bring it here because of that Seer and my one friend is waiting. So with this, I would like to say thank you very much. These are our co-partners, and this is my institute. So then with this, I would like to finish my thing and stop presenting.
Thank you very much, Manish.
Thank you very much. Thank you very much.
Thank you very much. So now I would ask Shudip, and Shudip has.
Shudip is there. Shudip is there.
Yes. Yep. I have to share this slide first. Wait a second. Okay, you are doing it. He has.
Professor Shudip, you are not audible. You are not audible. Yeah, it's going to the presentation. Yeah, it's okay. It's okay. Clear. No problem.
Shudip, do you hear me? Shudip?
Yes. Okay, fine. Shudip, you can start, I think. There is a problem. Sound, there is a problem with the sound.
No?
No, I think your voice is doing some problem.
Voice is getting broken.
Yeah, it's broken still. I think you can increase your volume, I think, a little bit.
No.
Yeah, it's broken.
Shudip, you had your connection number 2. Use your connection 2, second connection. Through your mobile. You speak, use your desktop for screen, sharing the screen. Can you do that way?
Okay.
Use your telephone. Now?
Now is okay.
Shudip, can you speak? This is through your mobile. The sound from Italy will not come.
Yeah. As it was severely infected, so probably it is broken. The sounds are broken down.
দেখি আমি এখান থেকে দিতে পারি নাকি আমি স্লাইড থেকে প্রজেক্ট করি তাহলে পরে then he can reduce the bandwidth perhaps.
Perhaps.
দেখি কোথায় গেল ওটা আমার তো
At that time, it was coming when he said, yes, I am present. Now, what is happening? Log out, log in.
Now is okay. Now is okay.
Yeah, it's okay. It's fine. Completely clear.
এখন তুমি দুইটা অন রয়েছে একটা বন্ধ করো মাইক
Now is fine. I think so.
Fine. It's fine. It's
Good.
fine. You can go ahead.
Yeah, just tell me if you don't listen me. Okay. So this is first of all, I would like to thank Vibhushan for giving me the opportunity to present here something what we are working on. But as of Manish and Poshunda, I'm not working mostly on water treatment. But as a chemical engineer, we mostly work on different material science things. So, can you hear me?
Yeah, it's clear.
Okay. So what we are working now actually is on membrane. So what membrane can do for these kinds of COVID viruses and on these kinds of bacteria or other viruses. So here you can see that in this in the next slide, but I don't know. Okay, so this is the schematic or the filtration spectrum that.
Shudip, go to the full mode of the slide, please.
Now it's fine, huh?
It's okay. It's okay.
So in this spectrum, you can see that in which kinds of membrane what can be separated. But this is just a small spectrum of different materials. As you can see that from the virus is based on starting from this size 0.1 micron, 0.1 microns, and it is going even down than that. So if you can see here that microfiltration, UF, and reverse osmosis, these are the three main membranes is available in the market and commercially. So by the different size exclusion principle, you can separate different sizes of particles, even viruses, bacteria by MF, microfiltrations. Virus, bacteria can be even separated by UF membrane. And if some virus or bacteria is smaller in size, they can pass on the other side and they can be separated even on reverse osmosis membrane. So with the RO membrane, only the water or the monovalent ions can pass on the other side, whereas it can be separated by any kinds of other salt or ions can be separated by these kinds of membrane. So nowadays people are talking about different kinds of masks, different kinds of materials, different kinds of PPE materials, and many other different materials that which is good, which is bad. So nobody studied these things. But what we are working on, we as a chemical engineer, we are working on different principles of chemical engineering. So here, if you see that this is the virus particles. If you put the membranes on in some part of this filtration spectrum, it can be separated by the membranes. In this case, as you can see that we place the membranes here in this part. So virus or bacteria can be separated, and on the other side, you just get the fresh air. So that is the reason that masks are using by people, but those masks has also many different drawbacks or advantages. So what are those? We study the molecular dynamics, molecular modeling of different materials. We study 3 or 4 different materials that is mostly used by for making the mask, making the PP. But what we have seen that most of the materials, the virus pass from the one side and it can pass on the other side as well. But some of the materials, those are hydrophobic in nature, as you can see in this photo, that there are some blue particles and red particles. The blue one is the hydrophobic part of the spike, and the red one is the hydrophilic part of the spike. So this is just a small portion of the virus spike that we have taken, and we did the molecular analysis in atomic level, and we have seen that some of the materials they maintain the basic chemical principle, that is, they are working on potential energy as well as van der Waals attraction. So these are the different materials that we use: polypropylene, PET, and PLA. So what we have seen that here you can see that if the size of the particles are less, so that can be separated by the polylactic acid membranes. So, and also what we have seen that here, the polypropylene PP, the kit made by PP or the mask made by PP, this is a part of mask that we are generating now. We are doing research on now. These are filters that is based on our principles, what we have suggested, and this research is also ongoing in University of Kentucky in USA. So they are making the new membranes, new filters only for this virus separation. So we study these mechanisms, and we are just publishing a paper in Nature Materials by I think end of this month or beginning of next month. It will be coming out if it is they accept it. It is in the revision phase now. So we studied this principle. We studied the potential energy, potential difference of different spike or with the different materials, and we come out a new solution that can be prepared to make the new kinds of mask and new kinds of PP materials. So this is just for the air. In case of water, if the virus is borne by water, if like what Manish and Prashun is working, they are working mostly on the wastewater. So what we have seen also that starting from 0 hours until the 60 hours, the virus can penetrate until the 18 meters inside the water. So this is also, we have done this study by our molecular dynamics simulations and also computational multiphysics. So what we have seen that by these kinds of membrane, even we can separate the viruses, because if from the wastewater treatment plant, the virus is going on the other side, it is coming on the water cycle. At some certain time, it will go on the water cycle. So water cycle means that it will come again in the groundwater, in the surface water level. So we have to separate. So if we can suggest some kind of membrane that can be, okay, this membrane is already applied in different wastewater treatment plant, but most of the treatment plant where they treat the wastewater, they don't use membrane always because it is expensive. It is getting plugged very fast. So we have to design. So we are now designing different membranes, different port size, different materials of the membranes. by which we can separate not only the virus, also different suspended particle. So here you can see that the raw water, that means the wastewater, is coming to the channel. This is like suppose this is like a treatment plant. We can put different kind of membranes on different level of the treatment plant actually. And at certain level, you can have the fresh water as a permeate on the other side. Whereas the virus or bacteria, it can be separated, it can be absorbed on the membrane surface, and then we can treat the those membrane according to the different other protocols that we have to define to get rid of the virus. So membrane filtration is a advanced mechanism that can reduce the virus contamination at certain level, starting from the water as well as airborne viruses. People now are talking about the virus can be spread by air. So if we are successfully design the previous this mask actually, so it can give you also other possibility to take the advantage of making different materials for the PPE kit, as well as other things like mask and other protective gears for the health workers. So these are the membrane that we just started working on from last 2 months about this COVID. So these are very small results, and I think we are very satisfied with the result that we have. We already published, as Manish and Kushun showed, that we published at least 2 or 3 different articles in different journals. And with our new data, we are publishing. We already submitted the papers to Nature Materials, and I think it is in revision. And this is one of the first paper that we are producing on aspect of chemical engineering. And I think this is enough from my side on virus. And I think if Tamit can present something from our side, if not, we will be happy to take some questions from your side. Thank you very much.
Thank you, Sudeep. Thank you very much. So, will Tamid, is it possible for him?
So Tahmid, can you get online from? Can you speak and can I transmit your voice through this one? But do you hear Tahmid, Bivashan?
No, sir, still not.
They will not. So there is no bridging between the two. Okay. So let me do one thing. Let me present this slide. Can I get back this presentation? Which one? This one?
Present now. Sudeep,
Number 15.
At first you have to leave from the presentation part. Sudeep, stop presenting first, then
I have to take over.
Take over.
আমি তো full screen করে রেখেছি তো।
Sir, you can go through the present now mode. Click on the present now mode.
এখন দেখা যাচ্ছে?
No, still not. Sir, present now mode.
Just a minute, hold on. Let me get back this one. Let me put out
at the right side of the
জুমটাকে কি করে ওই করা যায়, মানে ডিসঅ্যাপিয়ার করে না? কন্ট্রোল ট্যাব, না ওটা যাচ্ছে না। ওকে, তাহলে তুমি শুনতে পাচ্ছ এখন, তাই তো? ওকে, ফাইন। ওকে ওকে, তার মানে এখন তো আমি তো স্ক্রিন শেয়ার শুরু করিনি এখনো। present here, then আমি তো বলছি তুমি আমার বাড়িতে চলে আসতে।
I think I can
yeah.
Pushunda, I think I can. Okay, you can start.
Okay, it's coming.
এখন এসে গেছে, সুতরাং happening?
Yeah, it's okay.
Now?
Yeah, it's
Okay.
okay. Fine, it's fine.
So now I'm actually proposing, because as I mentioned before, in Sweden, KTH Stockholm, we were one of the most early bird risers on this COVID-19 issue, and we started with different, and we tried to go up with the global water community, because we had a natural advantage of working with arsenic, and by
Yeah.
virtue of that, we have the global network with all of us who are working on this global health programs, and so it was easy to penetrate. And Manish is also, as you know, is one of the as a high impacted researcher on arsenic and fluoride in the past. So Manish has also developed his third specialization on wastewater treatment. So as Manish, even in right now, this wastewater is getting. So in Sweden, what we are doing, we're actually KTH is on the central pillar, and that's KTH together with Science for Life Laboratory. Laboratory, this is a collaboration between KTH, the Karolinska Institute, and and Stockholm University is also partly involved there. And then together with Stockholm Water and Waste Organization, then we have a municipality of Värmdö and the this water company, this water company Chapala, and together with KWR, International Water Association, Membrane International, the Institute of Membrane Technology, and several other partners from the University of Milano, ICRA in Spain, and IIT Gandhinagar. So this was the essential part of this consortium, which we started working right from the beginning in May. So the team KTH is actually Zainab is leading this project, because she's basically a wastewater specialist and engineer working as an associate professor at KTH, and then me, and together with David Nielsen. David Nielsen is the director of KTH Water Center, and from the Science for Life Laboratory, we have Professor Cecilia Williams, Andishan from he is microbiologist and specialist, and Tamid is also working with us, a research engineer, and Tamid also has got a wide experience on working in water sector, primarily from WaterAid, Bangladesh. So what was the aim of this initiative? When we started way back in, now we have to say way back in March. So we had to develop a wastewater bound tool to estimate the prevalence of SARS CoV-2, because we didn't know actually how the daily developments happening. Because what was happening in Sweden, every day at 2 o'clock, there was an official press release made by the Swedish Public Health Agency. And this number normally is to give the total number of cases which has been reported, new cases, death cases, and persons who have been released from the hospital after the treatment, so those who are cured. So that was a normal statistics. If you go into the website of the Public Health Authority, you can see the cumulative of these different estimate. So essentially what we are trying to do with this estimate, it means that based on this wastewater SARS-CoV genetic signatures, we are going to try to find the zones, so high risk zones, medium risk, low risk. Now what we see now, the governments globally are taking some steps to minimize the risk of infection. Okay, so now it has been done in a very blind fashion, because it's like you're tying up your eyes and just appearing to work. So now the effect of one of the impacts of this wastewater-based epidemiology tool will be that the whole system will be more intelligent. So it's to develop intelligent monitoring, and the surveillance system, in other words, will lead to a more intelligent means of combating the crisis. Where to put lockouts? So there will be more demand-driven lockout. That yes, you have a high population infection spread risk, so we need to really contain entry prior. So, like for example, in Helsinki, for example, in March there was a severe stop of traffic from Helsinki municipality area or the greater Helsinki municipality to other parts of the country. Okay, so that you can contain the disease totally within that region. And this is only possible if you have a more detailed information system. So perhaps it was not necessary for people in all the people in Helsinki city to be blocked down. Okay, instead specific pocket people should be. So these are some of the advantages. So we can do this sort of thing. And then and how do we do that? So we are actually optimize the viral RNA isolation method from wastewater. And I think Manish has already told the latest state of the art, what has emerged right now, verification of the viral RNA isolation. And we are now talking about the quality of the RNA. And this is, and then the optimization of method. So these were the initial objectives when we started the operation. So we are still working on some of these operations, and Sweden, everything is very slow. So we have the preliminary indications of higher various number of viral copies of this genetic material in some specific locations, which already had indicated clinically high incidences of the prevalence or the high number of patients in the areas. And that was also marked with considerable number of deaths. And finally, based on that, we need to develop mathematical estimation model. Preferably, we are using different tools, like we can use, for example, Monte Carlo simulation. We can use several other types of mathematical model to try to link up this total SARS CoV number in the wastewater, which we are actually detecting, to the actual population who are infected or affected in a given population. So these are the first step. First step is the sampling, identification, RNA separation, and secondly is to determination, and then trying to analyze in the RT-qPCR method. And so what we had so far, our results have shown that the traces of virus were all found in different wastewater treatment plants. We had worked in 3 wastewater treatment plants, Bromma, Henriksdal, and Chapala here. And this is one of the samples what we are actually working on the samples here. And then there is no trace of viral RNA in the effluents in the water sample. So that one important message which came out, and it was also a very strong apprehension in Sweden: does the treated wastewater have the traces of coronavirus, either life or death, So then there was no trace of viral RNA. So we didn't find any RNA in the treated wastewaters in the region. So we were, in a nutshell, when we are trying to work on, was that we have a proof of concept, sampling program, and protocol, which will lead to some sort of piloting. And I think I'm trying to work parallelly in India and Bangladesh to achieve these goals. Meanwhile, when the Sweden is trying to come up with the results after the vacations in August, perhaps. And then this will be, SWE is the national level of surveillance, which is going to give the nationwide interactive network and a map of the whole project. Because once we started this thing, it was on the media in Sweden. So there were several questions from the media itself, that what is the current status of the disease burden. So and that's what we have been working on. Thank you very much. So now I will get back and wait to do the questions.
Thank you. Thank you, all of you, sir. Now I am requesting the participants, if you have any question, you can directly, you put on your microphone, you can ask our panelists directly the questions. Lakshmi Sarkar, please turn off your video and presentation. Stop presenting, Lakshmi Sarkar. You are requested to stop the presenting. You are stop presenting, please, Lakshmi Sarkar. And all the participants, if you have any question, you can directly ask to our panelists. So first of all, I want to say, okay. If
hello, sir.
Yeah.
I have a question.
Yeah.
Can I ask?
Yes, yes.
Yeah.
You can.
Yeah, Syria wants to ask some question.
Yeah, sir. Sir, is there any way COVID can spread by sharing a common washroom, even if the general hygiene conditions are being maintained? Also, can COVID-19 spread when we wash our mouth with water and that water goes to the sewage system?
So your question is directed to whom?
Sir, in general, to anyone, whoever
Okay.
wants to answer.
You are talking about infectivity. I mean, can you repeat just one time, because I thought it is just directed to the gang leader, that is Professor.
Actually, I can answer it, Manish, if you want, because I think there are some discussions going on. I think one of my second slide had that thing, that infectivity of the virus is one of the risks, because if you have the live viruses in the toilet, for example, when you use the toilet, you don't flush it properly, so there are potential risks. And secondly, even there are some sort of, if you have in high temperatures specifically, you have this the effervescence, or the not effervescence, the the evaporation can also lift up these viruses. You know that there were several number of papers which had actually shown in, I think it was in China or somewhere else, where we were looking into the ambient air quality, and they're getting signatures of virus coming out from the toilet WCs in the inside, and also the sewer vents. So there are some risks associated, but it's not that critical, because if you're using proper toilet hygiene, you are using disinfectants, so that is a must. So you need to practice those hygiene. So there is no substitute for maintaining that thing. Manish, your further comments.
Actually, I would say, of course, there are some studies coming with the airborne and so and so forth. And what I would say is that being panicking is really, really worst thing that we can do to ourselves. And as far as the studies related to enveloped virus goes, it gets killed very soon. And and another thing is that when somebody tried to grow, take the virus and incubate it and grow from the fresh fecal method, and the infectivity was not there. They could not grow it. So because a lot of acid and lot of things through the digestion, if it comes, there is no study so far could able to extract the virus from a fecal matter and grow. Which means that a urine, something through the feces, the virus coming alive is very far cry. So far, there is no study that claims that, as far as my information goes. So that's why I would answer it completely no, rather than telling you that or something like that. But having said that, proving there is no God is very difficult, and I mean, is almost impossible. So proving that there is no infectivity is almost impossible. However, I can completely say that nobody could prove the presence of infectivity. So I would not like to say there is no infectivity, but I would be saying that there is no infectivity proven till then.
Use of the public toilet should be restricted. That's the precaution.
Yeah, but still you are free to take.
One of the keynote to carry home message, that one with the use of the public toilets, some things, they were one of the things where you have limited, so that there are some because the longevity of a live virus varies from 4 hours to 14 hours, right? Depending on the situation. So that's if a bad toilet, for example, the infectivity itself is not very much.
But just now I'm sorry to just add a little bit further, because now I can read Syria's text, and she is saying that how about also can COVID-19 spread when we wash our mouth with water and that water goes to sewage system? Yeah, this pathway I cannot deny that there will be not a living virus or a incubable virus or a virus that can infect will be not there. But again, I would repeat that through the fecal method, no. The kind of acidity or the pH or the digestion system human has, no, that enveloped virus cannot survive. Actually, now I will write a commentary, because today I am now feeling more confident telling you this. So
yeah,
that is the more thing, that because nobody is taking a stand, but it's time to take a stand.
Okay, thank you, sir. Sir, it is for Professor Bhattacharya. Along with the regional risk assessment, can we translate the sewage viral load to reflect the SARS-CoV load per million population?
Yes, that was our main ambition, because if we look into a given a specific drain or a catchment, as we call it, the total number of population residing in a given link. So in a given catchment, I mean, it's also a link, because you have that drain coming into, which is actually bringing all the wastewater. So it's coming. So the question here is that how do we really translate that? And it's a factor of so many things. Now, the Manish, the practical, the sampling, preparation, and present, and so that is one important thing. If you can really concentrate it and take that sample as a representative per capita person, so then you can easily do it. It is much easier. So the calculation effectively should be precisely done as what Ahmed et al. Has done in 2020 article. It is very interesting. Otherwise, if you do a dilution, if you do a concentration, then you have to recalculate the entire viral RNA load into that. It's just like into the concentration factor, and then you have to do the calculation. So Manish, you have done it practically. So we are still waiting for our results.
Yeah. So actually, I want to know the name of the person who has asked this question, because it should be recognized. Because this is a very the question that is still we are trying to answer, and as per my guess, there will be several answers of it. Every city, every town, every country will have the different coefficient of this the two, which will relate the number of the gene and people infected. So the first answer is yes. It is. I mean, a correlation can certainly be established. Some of the work Professor Bhattacharya has already mentioned that yes, has been going on, but so far it has not been succeeded. What we generally do is that if I one wastewater treatment plant I sample today, and if I sample 7 days after and 1 month after, if the number of gene goes high or low or something, and so we took everything constant, and like say that okay, the condition of the wastewater of the right now is how worse or good than the previous and something. So even that way it gives the catchment, the idea of the catchment, but the coefficient, because there is one study that has happened yesterday or the day before yesterday, which says that even with infectivity, the heading of the virus changes. So even if a person who is at the beginning of the COVID virus infection or at the later stage of the part of that, the number of the gene copies that that person will shed or excrete will vary. So how to correlate the number of the people infected in a place and correlating with? Having said that, I told you that of course there can be a coefficient used, and which will vary from treatment plant for city, for continent, for everywhere. Even there will be diurnal change, and that's why the importance of the sampling time become very, very important.
Okay, thank you. I would like to ask one question, please. That is,
No, you are not allowed.
Oh, okay, okay.
No.
Okay, just there are lots of population density in India, in such a country like India. So many people are working in the water supplying system. Suppose people who is infected with the SARS-CoV, because there are so many lots of people they are not aware of the infections. So if that people is working in that water supply system directly, and somehow infection is coming to the water system, where from that particular water circulatory system, can it, as it Professor Bhattacharya said, that it can be alive for 14 hours, so can it go through that particular water chain? Can it be transmitted through that water supply system? Sir, your microphone is off.
Yeah, sorry.
Yeah.
Manish, you can supplement me later on. So whatever. So you have the advantage of doing it practically. So no, but what I hypothesize, because of all the studies which have been done in China, for example, during the past 3-4 months. So there has been a huge amount of studies which have been done in China, and many of them have been coming up in a very rapid exponential rate, even especially from China, based on the SARS-CoV-2. So some of these studies have shown some of these some aspects where they show that there will be no prevalence of any virus in live water samples, in the water samples in a live or in a more active form. Okay, so that's one thing. Now, but how does that really impact in a much more wider scale? We still need to do some more practical examination. Firstly, we already have from KTH, we have a small parallel project which we are trying to do, looking into this. We are trying to work out the prevalence of this viral RNA fragments or the virus itself. You can see, but firstly, we cannot see any live virus. That is ruled out. So we cannot say that the viral disease is going to transmit through that pathway. No. Okay. According to the knowledge what we have, isn't so? That's the thing. Manish.
No, I think I would better take one question by the one person. Anirban Mukherjee has asked that although this is related to the Sudeep, what Sudeep presented, he is asking that is it possible that viral particle could be present and transmitted through water? That we have discussed a lot. But the later part of that, he is asking, if so, can it be filtered and used for drinking? So maybe Sudeep wishes to tell that whether virus can be filtered and then water can be used for drinking.
Okay, so I think so my answer is that there is still no. Okay, there are some membranes, but the size of this virus, which is like few nanometers, and it is still not possible to filter through the present membranes. So we are working on developing new membranes with new pore size. So I hope that in few months or few days or few years, I don't know when, so it will come. But the current form, the membrane that we have right now in market or in commercial available, is not possible to filter these kinds of COVID virus or these virus of this size, these kinds of size that we have in COVID, like few nanometers. It is not possible. It is possible to use some membranes like it is called reverse osmosis, but at home you cannot do that because it needs a lot of pressure. It needs at least 70 to 80 atmospheric pressure, which is impossible to get at home. So at home you cannot do, but in the commercial plant, maybe they can remove some particle. They can remove some virus also in commercial, that is a wastewater treatment plant. But at home, it is still not possible to remove these kinds of by the filters.
Okay.
For you,
yeah. You proceed.
No. You said this is your job, not.
No. Actually, there is another question I would like to ask Sudeep, and that is directed to Sudeep directly. That's why I was asking. So if you say something.
No. I was also reading that question. That
okay.
He is lucky to have another.
Yes. Recently, I heard that synthetic masks are more effective, and some work are going on these, and some repulsion theory is working behind this. Is this news true?
No. So actually, what is happening? There are some electric potential. So that is the electric thermoelectric the kind of coatings. So there are something like van der Waals attractions. That is the main reason to have the attraction of virus. It's like magnet. No, when you put north and north, they get repulsions. They are not attracting each other. So virus, they have like 60% hydrophobic character, the spikes, and 40% is hydrophilic. So hydrophilic means that they attract with the water, they attract with the different surfaces with the hydrophilic characters, but 60% is hydrophobic. So that is the reason that we are working now on preparing some new like molecular dynamics that can give you some idea, no? So which is the best solution, like that we present, that they present a potential energy, the potential energy between the surface and the virus spike. So that is the most important to understand what is the energy between the virus and the surface. So what you are talking about, it is rubbish. So there is no study still now. There is nothing has been studied before in this area with this COVID.
I mean, can I just add on one point here? Because I've just sent and on the note, there has been a publication way back in 1985 by American Society of Microbiology, virus persistence in groundwater. And during that time, in this paper, what they have done, they have looked into three important virus categories. I mean, CoV was not there, so they didn't do this one. So what they had actually shown here was that they have done three viruses. One was this poliovirus, second was ecovirus, and the third one is MS2 coliphage. Okay, so now these are the three viruses which they have tested. And what if essentially what they have done, we cannot really blindly say that there is no virus. That's what my message here is, that we need to do, and that this is where we need some research, so that we, I mean, and especially to assess the infectivity status of the groundwaters based on any remnant viral remnants, to say. So this whole branch has been developed, but we, unfortunately, none of us have ever looked into the virus. Even I have seen many papers linked virus with arsenic, for example. You know, so those papers are not taken that seriously until we have now in a phase where we must look into the virus. You get my point? Yeah. It is to the level of how deep we can dive in to understand the mechanism. And this is first step. Second step is to understand the molecular mechanisms. What happens? How are these DNA molecules and RNAs are built up, and what is happening? So these are much more advanced things to dive much beyond. Thank you.
Professor Bhattacharya, there is another question for you, and the question is that, can saliva used as a biomarker?
I think so, yes, definitely. Past studies on SARS CoV and even MERS, they have shown that human saliva has this, because, and human saliva in many contexts has remained under, they have not been trusted that much for different, as a very specific biomarker. I would say yes, definitely. Saliva can be used. We have lately, even for arsenic research, we have used human saliva as a biomarker for arsenic exposure. Arsenic, and now it's also on fluoride exposure also you can use human saliva. So human saliva is a very strong tool for identifying the metabolic processes. So there are two types of biomarkers of exposure and biomarkers of metabolism. So these two biomarkers have to be identified, and each signatures has to be understood how we do it.
Okay, there is another question from Shomo. Yes. If the virus is non-filterable through domestic wastewater filters, what is the safety measure should be taken? And is this enough to drink the filtered water after boiling it? I think so, yes. If so, what should be the preferable temperature? So temperature is still not identified the maximum temperature that virus can sustain. So some study from France, it was saying that until the 90 degrees Celsius, virus can still be active. Somebody is saying that after less than 4 degree or less than 10 degree, 4 degree, the virus cannot sustain. So there are still some confusion, because I think the metabolic pathway of virus is different. Now it is changing day by day. So it is still not defined the exact temperature the virus can be killed or can be removed. So the first question I can answer, because there is no still any filter available to remove these kinds of COVID virus, as I mentioned before. So and also in the domestic water filters cannot remove the virus. Even it cannot, like in India, people are using AquaGuard and other things. So those are just for selling. So they are saying that it is reverse osmosis. This can give the UV filter. It is not, because those cannot attain that pressure that should needed to purify the water. So domestic filters cannot remove the virus. That is my understanding, and it is somehow proved also, because virus, it works on the size exclusion principle. So there is no filters available in market till now for to treat the domestic water.
There is one question here from Shakuntala Garai, and that's on the, are there any data available regarding COVID contaminated municipal solid waste? I think this is a ongoing discussions. Even there are several panels which we discussed with WaterAid, for example, in India, and then there was some also in Hyderabad. We had the last seminar, so there were discussion on this fecal sludge management people, and that there is a potential. So again, the question was methodology and the what sort of method they are going to use. So we don't have that sort of data on COVID-19 specifically, but there are some information about the other viruses on these. I think virus, as I mentioned, there is severe lack of information and data on the viromes. I will not say virus specifically, viromes, all the viruses together, you know. So this gives a unique opportunity to study the overall virus. I mean, for example, if you have a fecal matter, what sort of virus exists in that? Maybe we also have the influenza virus, for example, and the other types of viruses. We have to do a regular study.
Okay, there is another question from Anshika Sinha. Nowadays, many are concentrating on homemade mask, but is it as useful as commercial mask? No. Homemade mask is nothing, just because it cannot protect the virus. It does not has that it has. I mean, I don't know how to explain, but because normal mask that we have, not the normal mask, it is like a dense layer. It has a dense layer, and also depending on different characteristics of the materials. But the homemade mask, they do not have the dense layer. They can just like a transparent. It can, if you make a blow from one end, you can receive the other end, the similar kind of blowing. So it cannot remove the virus by these kinds of homemade mask. Okay, it can remove some suspended particle from the air, but virus and bacteria cannot be removed by this homemade mask.
So another question is there from our faculty member, Jhulan Basu. She is asking that, can wastewater help in tracking outbreak in India? I think Professor Manish Kumar can answer this.
What is the question? That whether it can help?
Can wastewater, yeah, help in tracking outbreak in India?
Certainly. Certainly, it can do that because I told you that, and all of us has, I mean, the person and me has told about the wastewater that there is several advantage. That 72 hours is the minimum that if a person, even if with the infection, can start excreting. But a symptomatic patient will also excrete. And so definitely, and like I shown for the case of norovirus also, it can definitely help to detect the early warning system, and the early warning it can give. And it can also let us know that what is the pandemic curve, whether curve is flattening, still picking up, because now we reached as a third most infected people in the country is India now. So this kind of the thing on the individual testing where the dynamics are changing every day, it is very difficult to say. So for that also wastewater surveillance is very much important. And for that matter, I want to let audience know that we have UK has adopted for a national surveillance. The several countries are coming forward and trying to include the wastewater surveillance as a part of their COVID monitoring the system. So that is happening, and in India or elsewhere, everywhere it can help. And with this, I would just say that because now it is 9 we crosses, so at one point of time we need to close. So
yes,
I
I think so. We are.
Yeah.
But in any case, we are. I think we can share our presentations partly, and you can all be accessible by email, so you can put your questions and you can write to us.
Yes. The questions, rest of the questions, I can forward you through the email, sir.
No, also if somebody has any particular questions for someone, someone of us, they can just write us also. So you can just share the email address of ours with the students, so they can write us directly.
Yeah.
So okay. I mean, remember one important thing, because I think until yesterday there were approximately 600,000, more than 600,000 cases of COVID-19 cases in India. So and then if you really look into the regional distribution, you need to really come up with a smart solution. There is no other way. You know, I'm concerned about my own safety and my own travel to India. You know, our travels to India. So to that part. So that is also at a great stake. You know, so we must solve this crisis.
Exactly.
So we must solve this crisis, and how do you find this intelligent solution? And I think West Bengal specifically has a long way. So I think, and then one question which I posed to Manish, your suggestion about what happens if when Amphan had hit Kolkata, and how does this COVID restriction and so much of thing, does it have, is there any, will it get worse, or do you have any sort of suggestions or anything?
I would say that if Dr. Mandal or anybody, so far, because the parcel has been initiated, so if they can, some nodal expert will be there, then they can reach to the municipal corporation or the UNICEF, or the many people can come forward. But somebody has to say that, or to tell that, yes, I have done it and I can do it. So if that is happening, then it can spread, and then only the different state government can come together and make it a national program. Otherwise, like recently we have seen that Hyderabad has started, or some other cities will start. So the city has to wake up, and then when the city will wake up, then the state will wake up, and when the state will be coming together, it will become a national program. And what is needed is the expert, or somebody who has the on-hand training. And for that matter, I think Professor Bhattacharya is doing a lot of work. I mean, because connecting this kind of the webinar is also a part of that thing, that expedition that is happening. So if some of you or any of any listener wants to come the part of the global collaboration and wants to learn from us, we will be ready and helping them.
Absolutely. I think thanks. I would like to really acknowledge the Bivashan's the kind gesture to organize this seminar specifically and this whole series of webinars what in which you are organizing, and it's really a great initiative and it is much appreciated. I think this has to be scaled up even more. So we had, I mean, right now I didn't show some of the one global map where we have seen the wastewater surveillance has been adapted globally, and it has to be seen how fast we can really multiply the initiative in India. Manish has started in Ahmedabad. There has been one initiative in Jaipur, for example, in Western India, and how I think this is really would have been a good study if one could have just started in West Bengal as a first thing. Not to understand, this is not a research project, this is action research project. So there is a fundamental difference between a common research and action research. So here you need to deliver results rapidly. Okay, so this rapid phase research is very essential, not a conventional research. So I would like to really encourage you to understand this and try to implement a rapid investigation phase. Thank you very much.
Thank you, sir. All actually, I would thank all of you very much, because many people, we all are actually focused on the vaccine part, development part, and all these things. But these are the ground level problems we are facing. And one thing I would like to mention, sir, that is in the post Amphan sessions, at the before the Amphan, it was most of the cases in West Bengal was concentrated from the Calcutta city, Calcutta, and the 80% cases were concentrated in Calcutta. But out of Calcutta, it was not so concentrated. But at the post-Amphan period, the districts are affected, and many cases is coming from the districts, mainly the affected districts. This is the South 24 Parganas and the part of the North 24 Parganas. So I think Amphan has a greater effect on that, because people was actually fighting for the survival. They were in the same, there was no such social distancing maintained for their living, and so it complicated the situation as a whole. So I think this is the reason why the one thing everyone is saying, that due to the movement of those workers. But it is another question. I think this is another point, that at the post-Amphan period, it is complicated for this thing. It complicated.
So, I mean, in that case, in post-Amphan period, so there were people who were actually put on the rehabilitation camps also, perhaps.
Exactly, sir.
So that can be translated almost similar to what we have Rohingya camps in Bangladesh, for example. So those sort of an unplanned sort of human. So that is where there is a great need of, it's important to understand the dynamics of the virus in such clusters, you know. So that is one thing which you can take it. I mean, this opportunity will not come, will recur. So you need to understand, so that try to develop some sort of a preventive measure so that they are saved actually, those who are not.
Exactly, sir.
I think now with that we can round off this meeting.
We can round off. Yes, sir. It's okay.
And with a note of thanks to everyone for, I think we still have now 99% people who are on this call. So we thank each and everyone, and those who have also left. And thanks a lot for my side.
Please write to Pashun, Manish, or me, or anyone else. We can respond as much possible as we can.
One question I would like to just respond very, very quickly about, because it is related to, you know, Dr. Mandal, what I liked about this, and somebody has also written that the interactive session has been really, really very interactive.
Yes.
It is called interactive sensor, but there is not always such kind of interaction happens. And I would congratulate the panel member, including me, but mainly that we try to go and read the question and try to answer them. But jokes apart, it happened because the questions were very naive, very direct, very human. That is what I would say. And the people were not very much reluctant that whether should I ask it or not should I ask it. So I think that part was very mesmerizing for me. And so one question came is that
daily, do you have any daily practices that we can do it to minimize? I don't know where that, yeah. So then, so can we say something daily plan that to say it? I would say watch your hand. Watch your hand, because the way that this virus can get into your body is through your face. And through your face is, of course, the one thing is that the mask and those things are there. But through touching your hand and apart from distancing, social distancing and mask is also a part of social distancing. So another thing that you can do is watch your hand. That if you will be aware of your hand, you will be not unintentionally touching your faces, and at the regular interval just clean. That way, I think it can minimize.
Another point, Manish, you already pointed out in your talk that the men are more severely infected. So what I have been practicing is use of aftershave. You know, morning after you're shaving, you use aftershave, because aftershave is a disinfectant. It's a
Has
very
Palmolive
strong.
has given you some money to increase
No,
the
no,
sale
no. I know this is not Palmolive advertisement. This is by practice. They're learning by practicing. You know.
No, by the way, you look
So
very smart when you
that's
say.
one thing, because instead of when you have hand, you're putting your different hand lotions and you can also use face, because this one of the primary source of infection is through the face, eyes. If you have this aftershave, that will protect you throughout the day. So that
Prasunna, that means you are promoting that if somebody don't have the disinfectant, they can move around with the aftershave lotion.
No, because
And
that
he
is
is
one way
also
of
saying you
saving.
that being in Italy, don't keep French cut. That is you are keeping.
I was in France actually on that time when I had this French cut.
Okay, so
All right, so it's fine. Thanks a lot.
I would like to thank all of the panelists, and it's a nice presentation from all of you, and we are pleasured for that. So thank you, everybody. Thank you once again. We are concluding.
Thank you. Goodbye.
Goodbye.
Thanks you.
Goodbye, everybody.
Amit, কিছু বলবে? Thank you. Okay. Fine.
Okay, thank you, sir.
Yeah, thanks a lot.
Thanks a lot, sir.
ঠিক আছে তামিদ, হ্যাঁ, okay.
Okay, bye.
Okay, bye.
Bye, everybody.
Bye. Disconnected. There.
So on the red button, you can, yeah. So all the participants are requested to leave, because this session, we had completed this session. We'll see you again on the next session tomorrow. It will start from 9 sharp. I think it's from 9:30 sharp.